Oh, we all know oxygen is vital to life, and now it's being used to help treat chronic, sometimes hard to heal pain. Joining us this morning from Gunderson Health System is Dr. David McNamara to discuss this a little bit more. Dr. McNamara, thanks for waking up with us.
Hello.
So this is, we're talking about a hyperbaric oxygen chamber. Can you explain a little bit what this is, how it works?
So it's a treatment that's been used for the last 2 or 3 decades to treat difficult to treat wounds. And we've just installed 2 hyperbaric chambers about a year ago here at Gunderson and are using them to treat difficult wounds in our wound center.
So how does it work? How does the oxygen play into it? How does it help heal these wounds?
So when a patient goes in the hyperbaric oxygen chamber, they're pressurized to about 2 to 3 times the normal atmospheric pressure, and they breathe higher than normal concentrations of oxygen. That oxygen helps treat the wound by stimulating the growth of new blood vessels down into the wound, also helping to mobilize stem cells and growth factors that will help a wound heal, and also can help fight bacteria that are around or in the wound.
Oh, very interesting. What sort of results have you seen with the use of these chambers?
So generally it's quite good for certain types of wounds. And, as with any medical or surgical procedure, results are certainly variable depending on the specific problem being treated. But for things like diabetic foot ulcers or for radiation injury after somebody's had radiation therapy for cancer, the hyperbaric oxygen treatment is often quite helpful as an adjunctive measure to other standard wound care treatments.
So this might be something to consider for certain patients. Now, for those who are a little worried, who are thinking about this, but are a little worried that they're going to be going into some space capsule type thing, that's not necessarily the case, is it?
Correct, it's not. A patient enters into one of our 2 hyperbaric oxygen chambers, which are big acrylic, very heavy, thick acrylic tubes, and it's clear plastic. And during the time that they're inside, they have phone-to-phone contact with the attendant, one of our nurses, who's right outside the chamber.
All right. So again, if you're considering if this might be for you, hyperbaric oxygen chambers now at Gunderson, they can just contact their general practitioner, Dr. McNamara, to get more information about it.
Yeah, the best way to go would be to get a referral to the wound center.
Okay.
And we deal with really difficult wounds of all different types.
All right. Dr. McNamara, thanks for sharing a little insight on this with us.
Thank you.
All right, about 8 minutes before 7 o'clock, we'll be back with the Check of Your Day Planner Outlook next.